Thanks, Bryn. Let's see if I can get the next slide up there. Oops, go backward. I also would like to add my thanks to the planning team and the staff and to Bryn. Bryn and I met each other person to person this morning. As for many of us, we collaborate with people around the country and around the world, oftentimes in the virtual world, and it's always a delight to meet folks face to face. But it's been a pleasure for the last several months working side by side with you, Bryn. I also am taking a minute. In your book, you will see there is an in memoriam to Ruth McCorkle, and you can read in much more detail. But I have this slide up here. I knew Ruth for many, many, many years. First meeting her around 1980, 81 when I was working out on the West Coast, and she was at the University of Washington. A year ago, they celebrated her career at Yale as she retired. That was Ruth speaking to those of us in the audience at that event. The upper right-hand corner, they had a number of posters there of her work and her impact. This happened to be her publications. They had another one that how many of these publications were cited in triple digits, some of them. And the extent of her co-authorship and the people that she had groomed. The lower picture is a group in the greater Seattle area. Some of us are farther afield now. When Ruth left Seattle, the chapter out there, the Puget Sound Oncology Nursing Society chapter, endowed basically a lectureship in her name. And so for well over 30 years now, different oncology nurses, palliative care nurses, some are palliative care in that picture, have been invited to come back to Seattle. And last year, this was the group that was there from the speakers, and we had Ruth remotely. She was unable to come, not because of her health at the time, but because of flight problems of all things. So we had her virtually there on a laptop at the podium, and she could see the audience could see her, and had a wonderful celebration of her. I do want to also then move into a personal note in terms of her impact, because it fits so well with today. There is a sentence in her memoriam that talks about the 70 doctoral students and the 30 postdocs that she coached and mentored in her career. But her impact and reach was so much farther. I never was one of her doctoral students. I was certainly not a postdoc. But there was always that time that she took with individuals. She was always direct and caring in terms of her feedback, and her contribution to shaping what is today the Oncology Nursing Society cannot be underestimated. She was a founding member. She was on an early board. And through the years, her contribution to building the science that has shaped our society and so many of our members has been an indirect legacy, not as direct as the 100 that she really influenced through her academic role. So we remember her with a great deal of respect and fondness. She also was one of the earliest nurses, as I understand, inducted into the Academy. So kudos to her on that. So, like Bryn, I've had personal experiences. I've had lots of professional experiences in terms of quality care for individuals with serious illness. Most of my career in the clinical arena was oncology, although I started in med-surg. But on a personal level, this really comes home when it's parents, for me. And having seen the difference between the journey to dying that my mother experienced versus my mother-in-law really brought home that part of this experience is driven by the individual. And my mother and father, who took the proactive approach many years before their death to make wishes known, to have that all outlined, to be very clear about what they desired, as opposed to my mother-in-law, who really was a denier, did not want to have the discussions. And then when the palliative care physician came at that moment to have the conversation with her, was completely shocked, like the carpet was pulled out from under her. We obviously revisited the messaging multiple times with her, but in the end, I would say my mother had a good death, and had been for a decade or more, had great quality care in her illnesses. My mother-in-law in that same decade, maybe not so. So is it a workforce issue? Is it that in those decades, the providers, these were not palliative care specialists, but they were internal medicine, cardiology, endocrinology, were those specialists as comfortable and versed and knowledgeable? I can't say, but the conversations were so very different in the care of those two women. I have a couple of housekeeping things before I turn this over to our first speaker. There are notes pages if you want to take notes in your book. If you don't have the book, it's out on the proceedings are out on the table out there. As you will see from the outline, with every session, there's a time for questions and answers. After the speakers present, you can see we already are set up for the first group of speakers and the panel Q&A afterwards. There are microphones on either side of the room. We ask that if you have a question, you go to the microphone, you introduce yourself, please, and also your affiliation. This is all being captured as part of the proceedings of this workshop. We ask that you keep your questions focused and brief, or your comments. Some of you may have comments, not questions, so we can accommodate as many people at the microphone. So be sensitive to, do you have a line behind you when you're speaking? We have given permission to the moderators. They do have the prerogative to cut people off if it looks like they are going on a little bit too long and there is a line behind them. That is to be respectful of all who would like to participate in the workshop. So those are the rules for the day. And the other thing, if you haven't been here before in this building, restrooms are around the corner here. So with that, let me please introduce you to our first speaker. Dr. Michelle Washko is a national expert on the healthcare workforce and currently serves as the director of the National Center for Health Workforce Analysis and the Department of Health and Human Services. She's been there since August of 2013 and has served as was the deputy director prior to her current role from 14 to 18. Her areas of expertise are around U.S. healthcare workforce and employment for older adults. She previously worked with the Administration for Community Living as a senior advisor on workforce and employment policy, and in the U.S. Department of Labor, where she developed employment initiatives for older workers. She has a very esteemed career. We are absolutely delighted she is here with us to set the foundation of the big picture of the workforce, because what we're also then going to address today is a subset of the bigger workforce. So, welcome.